All done. Okay, let us start now today's topic of discussion, the smelling diagnosis. Now I have made it simple. Olfaction, now smelling diagnosis just by smell. Now why is it difficult? Now I will ask you people that why it can be difficult. Like, there are almost 10 millions of colors when we are talking about the color, right? Okay, so if I say red, green, blue, and you can say, okay, in red also there are so many, different palettes, of colors. Inside even just red, inside just green, they're different. So there are 10 million colors according to my knowledge. It can be even more. Um when we are talking about smelling or odor, how many odor or smell can you actually describe? How many? Anyone? Tell me. The first thing you can say is it is bad smell or good smell. It's smelling bad. You will never say. When you see the color, you will always see, oh, it's red, it's blue, it's green. Maybe you are not coming in the, okay, it's steel blue, it's indigo, it's violet. That's something, you maybe if you're more advanced. Otherwise, if you see that color, you will say, oh, it's blue. It's like you can say. But when it comes to come to smell, you will say, oh, it is bad smell or good smell. It is like, oh, something is smelling, something is burning, something like, you will say it's burning smell. Or sometime you will say, oh, maybe my clothes are burning because you kept the iron, on the clothing iron, iron box on the cloth, and you forgot, then it's burning. Then sometime you can say, oh, maybe milk is burning. So you recognize, but can you give some name? Can you really give that name? Oh, milk is burning. You're saying milk is burning. You know how the milk, when it burns, how does it smell? But can you really give the name? There's no name for that, right? Okay, so that is why it is difficult, because smelling, you cannot give the name. You can compare to something. Oh, it's smelling fishy. It's smelling fishy. You're comparing to something, but you're not really saying what does it smell like. You say good or bad or neutral. Okay, smelling diagnosis. So, why it is actually difficult also. So we have to understand the olfaction. Olfaction means anything what we smelling. We have olfactory senses just in the nasopharynx area, right? So just behind the nose and above the nasal palate here, right? So those are olfactory sensors, and from there actually it is connected to the limbic system. The limbic system it is connected to. That's how we smell. Okay. And again, so yeah, it is by that. And these things are making it more difficult. Lot of things to confuse, right? First thing is cosmetic. If your patient is wearing something, perfume, aftershave, lotion, if they have applied, or soap, or other lotions, like body lotions or shampoo, it can actually confuse you. Clothing smell, some fabric, if have you, like, you have worn new shirt sometime, and it will smell like fabric, until unless you have a one wash. And even if you have one wash or two washes, then it may smell of the washing powder what you're using, or fabric softener what you're using. So that is confusing. Environmental smell, somebody has smoke or tobacco smoke from outside, even moxa smoke inside your treatment room if you're using moxa. Cleaning products what you're using, that fragrance, lavender and lemon and all those in the cleaners, what you say, floor cleaners, have a lot of kind of smell. And then cooking smell, maybe in your surrounding, not, you're not like cooking inside the treatment rooms. Or animal smell, all such things. Okay, cow dung and all those things. It can be anything. So these things can confuse us, and we have to really focus on these things. Okay. So smelling diagnosis, obviously, we are smelling the body odors. If a person is really smelling bad, especially if you have seen some people's armpit, and all those things, they smell really bad, a strong smell, especially in the buses. If you go in the metro or public transport, you will see some people are really, smelling stinking, So that is body odor. But the abnormal smell, as a Chinese medical doctor, we are also actually abnormal smell can come from the stools, urination, bodily discharges like sweating, even vaginal discharge or urine, and perspiration, which is sweating, underarms, yeah, I just told you, and the bad breath. So from breathing, all these things can actually give us clue about the our diagnosis. Even the nasal discharge can give us the clue about that. There you go. So sweat. Now sweat, if it is foxy smell, okay, foxy, or let's say cat, kind of cat smell, that will be damp heat in the liver gallbladder. That can give actually damp heat, yeah. Okay, so damp heat. So first thing, if the sweat is smelly, first thing, one thing, it is heat. Because if it is cold, there will be no smell in the sweat. No smell, right? If there's no smell in the sweat, and the people say they are not even sweating. So I have already covered that in what you say, heart inquiry diagnosis. I have already covered that. If there's no sweat at all, so that could be even blood deficiency and cold, yeah, because blood deficiency can create also cold. Yeah, so if there is a sweat, a lot of sweat, one thing is heat, yeah, but sweat has a lot of smell, that is heat. Yeah, okay, that is for sure heat. And if it is a damp heat, that will give us foxy or catty smell. Okay, smell like a cat. If there's a wind, damp heat, that can give a goaty smell. So see, wherever we are actually describing the smell, we are comparing with something. We cannot give the name of foxy smell, anything, goaty smell. So you have seen in Bakrid and all, Muslim people, they go with the, what you say, goat, and there's a lot of smell in the market when you go in that time, in the Bakrid time, when it's Bakra Eid, when they cut the goat, when they sacrifice the goat for Allah, So that in those days, if you go to market, you will see a lot of goats are there in like normal markets, even grocery market and everywhere. So that you can if that same smell you're getting from the patient, let's say, and it's strong, then you can say it's a wind damp heat. Not just the damp heat, it's a wind damp heat. Okay. So a strong smell is heat. Foxy cat smell, that is damp heat. Wind damp heat, goatee smell. There you go. Breath, somebody's breath can be very, very smelly. Like you can't stand near that patient. If patient is coming near to you, you already know the breath is smelling, right? So obviously you're not going to be near to the patient smell and all those things. You have to just keep in your head, if the breath is smelling, what kind of, is it really foul? If it is foul breath, that is the stomach heat of fire. If it is smelling sour, that is food stagnation. And if it is smelling fishy, like if you go to fish market or dead fish or something, if it's smelling fishy, that is a flame heat. Flame and heat together will create the fishy smell. So where you will get the flame heat? Have you bronchitis, pneumonia, right? Anything which connects the lungs, and create heat, fever, any febrile diseases of the lung, let's say, that will create the fishy smell, and that will tell you it's a flame heat. Okay, so flame heat. Think about bronchitis or any febrile diseases of the lung. Okay, so that will be fishy smell, flame heat in the breath. Nasal discharge. So smelly nasal discharge could be lung heat or damp heat. Now see the nasal discharge many times you don't have to really smell, but the patient will tell you, oh, my breath smells very, not maybe breath, but the nasal discharge or something, it is smelly or something, then they will tell you it's a smelly nasal discharge or a yellow discharge and all those things, obviously if they have connected problem. So smelly nasal discharge could be lung heat. Yeah, so lung heat already that nasal discharge will be yellow. Okay, that is lung heat. Nasal discharge will be yellow. And if it is smelly, obviously it is lung heat or damp heat in the spleen and stomach if there's an upset digestive system. So in inquiry, if they have already told you they have a digestive system is not good, that can also create the damp heat and can create smelly nasal discharge. So remember the stomach, large intestine. Yeah, we have seen in observation if there's a dryness in the nose, that is due to the heat in the stomach or large intestine as the channel goes near the nose, right? Okay, Li20 is just here, so we know that, right? And the stomach is just here. So nasal, so that is what we have seen in observation. Now, if there's a damp heat in spleen and stomach, that can actually give the smelly nasal discharge too. Obviously, we have to see in the inquiry if there's an upset digestive system problem. So if there's a digestive system problem, you already know it's a damp heat in the spleen stomach. If there's a lung issues, so then it is smelly nasal discharge because of the lung heat. And the rotten apple smell in nasal discharge could be from diabetes. Okay, so rotten apple smell, that is actually from the diabetes in the nasal discharge. Ear discharge, a lot of people have ear discharge also, right? Especially the children. If there's a foul smelling discharge from the ear, it is damp heat. Foul discharge. The smell is always heat. Foul smelling discharge because of discharge, so dampness, okay? So any discharge is smelling, that is foul smelling, that is damp heat. Because dampness means something discharge coming out, yeah? Okay. And heat is bad smell. Okay. Vomit. So now vomit, if it is foul and sour, foul sour smell, it is stomach heat. Okay, sometimes people can vomit if even in the hospital, patients can vomit in front of you, or you can actually smell the vomit, or you can ask the person, even the patient, how did it smell when you vomited? If they really have vomiting issues, then you're asking them, sometime, So usually I have seen the people with migraine, they have also vomit issues, and I have always asked them, how does your when you vomit, how does it smell? So they will say, I don't really remember, but it's really like rotten smell, something rotten, and that is food stagnation. So usually in migraine, I've seen people's digestive system doesn't function well, and they are not really hungry you know same thing in meningitis also, they are not hungry and they can vomit easily. So when they vomit, actually it is the smell like rotten food. They get all the food out when they eat it all, so that is kind of again like a food stagnation. So putrid or rotten smell. Okay, putrid or rotten smell. Foul sour smell is stomach heat. If it is fishy, that is due to spleen stomach deficiency. So if your patient say they vomit and it's like a fishy smell, they will be able to diagnose. If you really ask them how does it smell, or maybe next time you just observe and tell me, and that is fishy, it is a spleen stomach deficiency. So spleen stomach deficiency, obviously we are talking about spleen G deficiency or stomach yin deficiency. Urine, foul strong smell that you can't really you know that is damp heat in bladder. Damp heat in bladder can create foul strong smell. So the people own urine smell they can't stand and they have to close their nose, uh, that is foul strong smell, that is damp heat. Obviously when we go to urinals we can't actually it's very smelly, so we always know, what is foul and strong smell. The urinals in the sulab shauchalaya, they never clean and they always are stinky. I don't really want to go there. So that is really foul and strong smell. But if the person has the same smell for their own urine in their own toilet, in their own, facility, or in the five-star hotel or wherever, and they can't stand their own urine smell, that is foul, strong smell, that is damp heat in bladder. Obviously, in the inquiry, you already know there's a problem in the bladder, okay? Especially cystitis and all, yeah. The strong urea-like smell. If they have strong urea-like smell, that is heart fire. Okay. And if they have mild fishy, then it's kidney deficiency. So it can be kidney yin or kidney yang deficiency. Yes, Deva, the breath, smell, and vomit can interact with the food eaten. Uh, the vomit will not really interact that much because if there is some problem inside, like food stagnation will always smell like rotten and putrid, So yeah, breath smell, what is eaten, it's not like all the time, whatever you have eaten. Even if you have eaten something, you will always eat something fresh, and the patient is coming to you not just after eating. So if they're coming after just 15 minutes, that will be only food smell. I don't think so. It will really, if they're really foul smelling, even they haven't brushed their teeth, if they're really foul smelling, like they haven't brushed their teeth, that is a different issue. But they brush their teeth, then still they're smelling. That is the problem, actually. Yeah. Yeah. So it will not really interact with our things. Yeah, that's what I think. So if it is mild fishy or fishy kind of smell in the urine, that could be kidney yin or yang deficiency. That's urine. Stool, damp heat in large intestine, that will be strong and foul smell. I have taken care in the constipation, I think. Constipation and diarrhea, yeah. Okay, so damp heat in LI, that will give diarrhea actually because it's a damp heat. Heat in LI is different. So damp heat in LI, usually it will give diarrhea, strong and foul smell. It's like you cannot, if the person has just come come out from the toilet, you won't be able to enter in that toilet. It will be really, oh my God, you will say, you won't be able to enter that the toilet. Food stagnation, that will be sour and foul smell. Okay, sour, foul smell, and obviously the food particles will be in the stools too, in the food stagnation. If there's a spleen, stomach cold, then it will be fishy smell. Okay, so if it is cold in spleen, stomach, that will be fishy, the diarrhea, obviously, yeah. And toxic heat, it will be rotten egg-like smell. If there's a toxic heat, rotten eggs like smell. Vaginal discharge, that happens to every lady anyway. So but if it is just normal with no smell, that's normal. Whitewash and all those things, all ladies know. As a doctor, we should all know, sometime even ladies can question you. You're going to cruise ship and there is no difference in lady and what you say, ladies and gentlemen, the men's and women, they can ask you. Even if you're a man, I have been asked many times this thing, so these things. So in Western world, they are very frank. They will tell you if they have issue, they have issue. You're a doctor, you should know. So you cannot say, oh, I am a man and they should not. Obviously, in India, they won't talk. But in you're going to cruise, you're going to the Western world, and they will tell you if their vaginal discharge is smelly. I have encountered, not like often, not very often, but very rare. But yeah, at least 10, 20 times they have been asked. Yeah. So whitewash is normal. Everybody knows. Yeah. But if it is strong, foul, and fishy smell, damp heat in the liver, strong, foul, fishy smell. And because of that, actually, one lady asked me, I just want to share that husband do not want to sleep with that lady. Yes, he wasn't interested in intercourse with that wife, his wife, because of this thing. Yeah. And we can treat that. So they will tell you like this, just because of that. Yeah. So you may encounter these things. And obviously, if you are a lady doctor, the ladies will be more comfortable with you. But even you are a man in the Western world, they will tell you that. And because of that, that lady was in depression, because the husband didn't want to do intercourse or sex with her, because of these things. So yeah, just keep in mind and keep yourself open for these things, these question, and you have to be always confident. You cannot say, oh my god, what she's asking, and you started tremoring. You're a doctor. Come on. Yeah. Okay. So always know these things. So if it is strong, foul, fishy, that is damp heat in the liver. Mild, foul, and fishy, very light, that is cold, damp. And you already know if it is heat or cold by checking the pulse. So once you know the vaginal discharge is foul and fishy, the patient is complaining about that, and then just check your pulse. See how the pulse diagnosis. Just you have to check the pulse rate. More than 90, it is heat. Less than 60, it is cold. Now you know it's a damp heat on cold damp. Yeah. Okay, so see, everything is connected, and all the diagnosis, when you know, it's becoming easier. Again, with the tongue also, if it is a damp heat means the tongue will be red and redder on the side because the damp heat in the liver. Same thing is cold, it will be pale. So you know that. Stronger imbalance, stronger smell. Okay, and the stronger the smell, easier will be your diagnosis. Okay, because if the patient is really having foul breath, there is a heat. You have to treat that, right? There's already, you already know it's a stomach heat, obviously. Yeah. So stronger is the smell, stronger the imbalance, stronger the issue, and it's easy to treat also. The same thing happens in the Western medicine. If there's a stronger problem, you have a stronger diagnosis. And many times it's what you say, and not clear symptoms, not classic symptoms, then the people have difficulty diagnosis. So same thing you will also encounter in Chinese medicine. Sometimes you get the patient, oh, your diagnosis will be easy, and sometimes you have to really concentrate on many things, and then you have to come on the proper diagnosis. So as Western medicine, they have got the lab diagnosis, the path labs, the CT scan, the MRI, the X-ray, and so many other diagnoses. We also have got so many diagnoses, and so many ways to diagnose things. Obviously, if your Western medicine doctor cannot diagnose your problem, let's say just by the lab diagnosis or blood report, then they will send you for further things, X-ray, CT scan, ultrasound, and all those things, MRIs and all those things. Even further diagnosis we have got. So they will send you for so many things. So same thing, what we have to do, if we are not able to find out in the inquiry method, we are going into the observation method, we are going to palpation method. We are also getting some clues from the olfaction, from auscultation, all such thing, So see, when we are combining all these forms of diagnosis, what we are getting? We are actually getting our diagnosis more accurate. Because if one thing is conflicting with other thing, then we are diagnosing again. We are confirming it again. Is it same thing, And I'll tell you, whenever you are having conflict between two diagnoses, because it might be the symptoms of two things, and you see, like if symptoms you getting in the inquiry of one diagnosis, which is leading you to one diagnosis, and you confirming also with the tongue and pulse. But while you're doing the tongue and pulse diagnosis, you are actually diagnosing the second thing or third thing as well. Then you can treat all these three things. Come on, you are into holistic treatment. You're not doing surgery that you have to be particular about just one thing. You are a holistic doctor, right? Holistic doctor means you can mix and match. Yeah, mix and match. Some people have stomach heat, right? Have stomach yin deficiency, and what is a kidney yin deficiency or spleen chi deficiency? Two, three things together. You can get a person who is having stomach heat. Sorry, I told you stomach heat and stomach yin deficiency, they cannot stay together. But stomach heat, kidney yin deficiency can be together, right? And I've seen it. Spleen chi deficiency can stay together along with the stomach yin deficiency. Yes, stomach yin deficiency, spleen chi deficiency can be together. Spleen chi deficiency, and the liver stagnation, liver chi stagnation can stay together. You are going to treat them together. You're giving the liver point, spleen point also. If there's kidney yin deficiency, you're giving kidney points as well. So you can mix and match point. That's what we will actually, after this diagnosis, I will actually take a class on the selection of the points. How you are going to select the points based on the diagnosis system. Yeah. Okay. Now let us see the people. We have already done with the olfaction, but the 5 elements association of smell, we have to also see. And many times if you are treating the person with the 5 elements theory, then you might come under these things. Yeah. And mainly we are talking about the body odor here. We're not talking about sweat and this and that. So these things were not really connected with just the body odor, the smell. They were more with the excretion and all those things. Yeah. And the 5 elements are directly connected with the body odor, and that's why I am taking this also. Okay, so here you go. This is a chart. Wood, obviously we know it's connected with the liver gallbladder. 5 element theory. I hope everybody knows this is the generating sequence, and inside the circle, the star is a controlling sequence. Okay, so we should always keep in mind the wood. The wood organs will be liver, gallbladder. Obviously, if they have any disharmony, the smell will be rancid. So when I'm talking about the smell, these are not normal smell. They are found only in the pathological conditions. That means these are negative or abnormal smell. Okay. So wood, liver, gallbladder, disharmony, rancid smell, body odor, will be rancid. Okay. So you can actually ask these people, you can ask the patient these questions. When you're doing the 5 element diagnosis, you can ask and you will find the same thing. With the fire, any disharmony in the heart and small intestine, it will be burnt smell. I'm going to explain you further. Spleen, stomach, which is connected with the earth, the sweet smell, and the metal means lung and large intestine, rotten smell. The water, which is kidney, urinary, bladder, if there's a disharmony, there'll be putrid smell. Now here you go. Wood is rancid. And can you explain rancid? Who knows rancid? Anybody? Okay, let me actually play without showing you. Anybody can explain rancid? How does it smell, rancid? Let me also get some participation from the group. Spoiled oil or fat. Okay, that's good.
Decomposed smell,
No,
sir.
no, 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 Dr. Ashwant. I'm not talking about the rotten. I'm talking about the rancid. Rancid is like a fat, okay? It's spoiled. So it's more like fat or cheese. If you get a cheese and you keep it for so many days and then it's spoiled, and if you smell it, that will be rancid. Okay. Yeah, decomposed. Ashwarya, you are very right. Rancid, decomposed, kind of. Yeah. Okay. Who can tell me the burnt smell? I think it's very easy. The second smell, burnt or burning smell. What is the burning smell? Burning of what? Yeah, ironed cloth. Very good, Ashwarya. Ironed cloth. What else it can be? Barbecue. Okay. Amrita. Good. Okay. Anything else? Toast. Okay. Yeah. Burnt smell. Yeah. So the patient will tell you, oh, I feel like, my body is like, smelling like a burnt toast, or, or I'm in the barbecue, or something like that. Burnt smell. They will tell you the body odor if you ask them. And maybe not the first day, the second day they will tell you. Roti, burnt roti, no, no. Yeah, that will be a little smoky. Yes, could be. Okay, sweet. Who can tell me sweet? How does it smell? Sweet. Fruity. Okay. What about rotten? Rotten. Yeah, rotten egg. Okay. What else can be rotten? Okay. Who will tell me putrid? Deva fruity odor. In rotten, no. I think you're talking about the sweet. We already done that. Now we were talking about the rotten, dead mouse. Yeah, dead mouse is rotten too. Ammonia. Wow, Aishwarya, you are actually getting there. Ammonia. That's rotten. Is that's actually explaining you what is rotten. Ammonia. Smell of ammonia is exactly is rotten. Smell of ammonia. Aishwarya, you are brilliant. Yeah. Putrid. Who will tell me putrid or putrid? How does it smell like? Putrid. Putrid. Dead animal. Burnt rubber. Putrid. Stinking. Everything will be stinky actually. Rotten is also stinky. Rancid is stinky. Putrid is stinky. What is putrid? Dead bodies, yes. Saran. What else it can be? Putrid. Musty. No. Sewage, yeah. Decayed, yeah. Okay. Okay, let us see. Now we explode, so we are also using our mind. Okay, so first thing I already told you, it will be like decomposed or spoiled fat or cheese, and that is rancid. Okay, so wood is connected with the liver and gallbladder. So energy of the liver, gallbladder. So these meridians look after the production and storage of bile. Okay, responsible for breaking down fats in our diet. So they're giving you connection. Why wood is rancid? Yeah. Okay. Because liver, gallbladder, production, storage of bile. Bile is used for breaking down fats. Okay. For digestion of fat. So when this energy is weak or disharmony is there in liver, gallbladder, then the fat, you will get the smell of fat or slightly rancid smell like oil that has gone a little off, right? So again, spoiled oil or spoiled fat or spoiled cheese, that is means rancid, because your liver gallbladder will help you in digestion of these things. Fire is scorched. So I've given you the picture also. Smell of burning is thought of as the smell of freshly ironed clothes or clothes from a dryer. So in India, I don't think so we have a dryer. When you go to the cruise ship or in the Western world, they do have the washing machine on the bottom, and on the top there is a dryer. In even five-star hotel, they have a dryer. So if you give them laundry in the morning time, or many hotels, not just five-star, whoever is giving you laundry services, they usually keep the dryer. So they don't actually, what you say, dry the clothes outside. So they can actually give you the clothes within 2-3 hours also, like if you give them a special request. So same thing, if you go on a cruise ship, you will see, you will do laundry the same time, means washing the same time, and after washing the same cloth, you will dump into the dryer and it will be dried even like in half an hour or 1 hour, depends upon that, right? Okay, so that's what it means, clothes from a dryer and or freshly ironed clothes. It raises high in the air and will be found high in the treatment room. Okay, so because fire goes up actually. Earth is fragrant, some fragrance, sweet. Okay, Okay, but this is not really flowery, like really smell. It's like old dead flower. Okay, old dead flower. Usually, when you go in the bush or when you will go in the garden, and if you pick some dried flower and smell, kind of that, so it will be like that. So it gets up your nose. It has a slightly cloying and overly sweet sense to it. Okay, so it tends to engulf you if you have a smell like a dried flower also, dried flower. So same thing, it will smell like. So that is earth. Earth means earth is connected with the spleen stomach. Metal is rotten. So if the people have issue with the lungs, usually also with the phlegm and all, or if they have issue with the lungs, large intestine, they may actually smell like you go to the meat market. They can have smell like. So metal is the smell of the large intestine, the part of us that deals with our own waste. Think of the sharp odor you get as you walk by the meat section in a supermarket, or the smell of rotting leaves on the ground in autumn. Okay, so either rotting leaves, the smell of rotting leaves, or smell of meat in the meat market. All right, so that's metal. And the water is putrid, connected with the kidney and bladder. All right, so so like would we think of these organs not processing well enough, and we may get the smell of urine or of ammonia. That's what uh, who told ammonia? Aishwarya, right? Aishwarya told the ammonia. All right. So yeah, you will get the either the salty smell of a sea breeze or ammonia. So obviously, if there's stronger smell, if there's a problem, the problem I'll tell you. The patient sometime they are with the douchebag, like they are bedridden, and if you go near them, they will smell like ammonia. Same like this one, and so they have kidney bladder issues, something, so even the prostate issue if they have. So obviously that connect with the kidney bladder in our what you say Chinese medicine. Okay, so prostate issue if they have any issues with the bedridden and all those things, so you will see they have a douchebag and all those things, what you say, with a catheter, urine catheter and all, and they will smell like same ammonia. So obviously stronger smell like ammonia, that means bladder kidney issues are big. And if it is just a salty smell of sea breeze, the issue will be lesser with the kidney bladder. Okay, all right, there you go. And there you go. What we are trying to listen, what we are trying to hear. So hearing and listening is two different things. Listening means we are really observing, we are analyzing, right? Okay, so that's listening. Hearing is you're just hearing. You're hearing so many sounds, you can hear. Can you hear me? Means you can just it's showing your capability to hear or grasp the sound, But listening means understanding the sound, So listening is understanding. So that's why you heard me. Okay, yeah, I heard you, but I didn't listen. Means I don't know what you said, So that's the difference in hearing and listening. I hope everybody knows, right? Otherwise, you can say also hearing diagnosis. It will not be hearing diagnosis. You have to listen to diagnose, because anyway you'll be hearing those noises, but you're not paying attention. So that's hearing. You must be hearing the voice, the respiration, breathing, and coughing, but you're not listening to that, right? Okay, so the patient's voice, breathing patterns, body sounds like coughing sounds, snoring, belching, all such thing is analyzed. Obviously, snoring you cannot analyze, right? Okay, so high pitch or low pitch, and that snoring is also there. Yeah, but voice, respiration, coughing, and belching, that you can you can listen and you can actually make your own diagnosis. You can analyze that. Okay, so listening diagnosis. So just in summarized way, if it is a sudden loss of voice, that could be wind heat. With the wind heat, the person can have sudden loss of voice. Gradual loss of voice, that could be the lung qi or lung yin deficiency. Okay, lung yin deficiency, which happens in the breathing disorders, or even in COPD, the people usually have gradual loss of voice. Yeah, with the smoking, lung cancer, and all, you have seen the gradual loss of voice. Slowly, the voice is going down, right? Okay. Loud voice is excess. There is excess. That's why it's loud. There's something excess in the body. Soft. If it is soft voice, that is deficiency. Reluctant to speak, that is cold, or again deficiency. If there's so much cold, the people will not reluctant to speak. Excessive speaking is always again heat or excess. So obviously it's connected with the heat or excess. Right, so let us go further. Five elements, how it is connected. If it is shouting, somebody shouting, that's connected with the liver heat. Yeah, shouting. So you already know the excessive speaking or loud voice is heat, right? Okay. And if that is shouting, that's connected with the liver. If it is laughing and loud laughing, that's heart fire, right? Sing song, like they're speaking, that's connected with the spleen, the grounding, grounding effect. Because earth is grounding, has grounding effect. Feel like something is singing song while they're talking, So that's connected with the spleen. Crying, if it is sound like a crying, somebody speak and you hear like some people are like patient is crying, that's connected with the lung, metal. Groaning, groaning, you understand the how the paper and all those things groans, so that is water, means kidney, connected with the kidney. So that's connected with the five elements. Now just let's explore the sound of the voice. A loud and coarse voice indicates an access pattern. So everybody knows loud means loud, right? The person is really loud, the speaking normally, and they will say, oh, this is my normal tone. If you ask them to reduce their voice, tell them, oh, speak slowly, and they will sorry. And then they again will start talking in the same. And then they will say, oh, this is how I normally talk, So if your patient is loud, you know, and that is indicating the access pattern. Loud and coarse. A weak and low voice indicates the deficiency pattern. That doesn't have, the person doesn't have energy to speak. Deficiency, Qi deficiency, yin deficiency, yang deficiency, any deficiency. The person's voice will be weak and low. Now, sound of, if there's a lack of desire to speak, that means deficient cold pattern. Okay, deficient cold pattern, that is usually the yang deficiency. Deficient cold pattern, that is yang deficiency, so that there'll be lack of desire to speak. They don't want to speak. Yeah, so if you discover the yang deficiency again with the tongue, what you will see in the yang deficiency, who will tell me? Because I have already done the tongue diagnosis and the seniors are also there. Please write in the chat box so I can read who is writing that. Okay, Milan, no coat tongue. Pale swollen tongue is a yang deficiency. Milan, there'll be no red and no coat. That is yin deficiency, Milan. It's pale and swollen. Pale and swollen is yang deficiency and can be white coat because yang is always coming with the coat. Yeah. No Ashwant, teeth marks is chi deficiency, usually spleen chi deficiency. Yang deficiency, you will see pale and swollen tongue and may have the white coat. That is yang deficiency, white coat. Okay. Maybe thin or thick white coat. That is yang deficiency. Okay. Who will tell me about yin deficiency? Somebody can tell me because weak and low voice can come in the yin deficiency or qi deficiency. But no desire to speak is yang deficiency. Who will tell me the yin deficiency? What will be that tongue like? Yin deficiency tongue. Yeah, red tongue with crack and thin. So it will be red tongue, thin red tongue with or without cracks. Crack may develop with because of the body fluid deficiency. Govind Rajan, greasy yellow coat, no, that's not deficiency. Greasy yellow coat is always the axis. Yellow coat is heat, and that is showing a axis, right? So it's not. It will be thin red tongue. So yin always makes it thinner. Yang makes it swollen, right? Okay. Okay. So there you go. Lack of desire is yang deficiency or indicates a deficient cold pattern. The sound of voice, incessant talking indicates a heat pattern. If person is talking, talking, talking without getting tired and you want to like close your, you know. So obviously heat pattern because he will be also loud and he's just talking because he is having full of energy. Heat is excess, right? Excess means he has to talk and release the energy, which is excess, right? And that's why the person is talking a lot, you know. So if it is regular and loud, that is heat pattern. Now, if you see acute onset, the hoarse voice or loss of voice, hoarse, like, you know, they can't, hoarse voice, you can see something is stuck in the throat. And so hoarse voice or loss of voice. So that is acute onset. If there's an acute onset, it just came, that is because of the wind, right? Exterior pathogenic wind. Especially the throat is red and sore. So red and sore, that means obviously we are talking about the pharyngitis or laryngitis, okay? And that is obviously the people get with the wind heat, right? Wind heat, the inflammation of the throat, that means pharyngitis or laryngitis. So acute pharyngitis or acute laryngitis, that will give you the hoarse voice or loss of voice. If somebody gets this laryngitis or pharyngitis, try to observe the voice. It will be hoarse or may not. He may not be able to speak also, loss of voice. Especially the throat is red and sore. The hoarse voice or loss of voice, if it is chronic and recurrent hoarse voice, that will indicate the interior disease, such as deficient lung qi or lung yin deficiency. Okay, so deficiency of lung qi or lung yin deficiency, it will be if it is chronic hoarse voice. Okay, chronic and recurrent, and also gradual loss of voice. If it is a gradual, chronic is always gradual. If it is hoarse voice, is chronic for a long, long, long time. They have hoarse voice, like smoking people. They're smoking all the time, and their voice is hoarse. You know, if you've seen the chronic smokers, you know, the people who are smoking for 20 years and try to hear their voice is hoarse voice, you know. And then also if they get lung cancer and all COPDs and all, they will be having hoarse voice and they may lose voice later on, which is nothing but the lung qi or lung yin deficiency. So this is how. Gradual loss of voice also indicate the lung qi or lung yin deficiency. I already told you. The gradual loss of voice or chronic hoarse voice is both lung qi or lung yin deficiency. Who will tell me what are the symptoms in lung qi deficiency? Lung qi deficiency. Lung qi deficiency. What will be the symptoms? Inquiry method. What do you will see? Breathlessness, Kiran? Yes. Devashri. Catching cold easily, breathlessness, yes. Catching cold easily. Not necessarily cold. Catching cold easily, you know, breathing difficulty, yes. Okay. Low immunity, yes, because he's catching cold often, recurrent. Allergies, yeah. Skin disorder could be, yeah. You're right. Okay, so you all know. How you will asthma is the not necessarily lung qi deficiency, not necessarily, yeah. Okay, asthma is more constriction, it's more allergic, yeah. It asthma may not be found in lung qi deficiency, it is something progressed further. So obviously lung qi will be deficient in asthma, you can say, but you can't say asthma is a symptom. Asthma is itself is a big disorder. Sarang, it's not also flu. Flu is not the lung qi deficiency. No, that is more wind heat or wind cold. Yeah, usually shortness of breath or difficulty breathing. That will be the first. The fatigue will be there because it's a qi deficiency, right? Okay, and catching cold easily and allergies, right? Those will be more for lung qi deficiency. Lung yin deficiency, difficulty breathing will also come, okay? But in lung yin deficiency, what else we will get? Because it's a yin deficiency. Tell me, what color tongue will change or what in inquiry we will see in lung yin deficiency? Who will tell me? Lung yin deficiency. Lung yin deficiency. What we are going to see? The tongue will be red and thin. Yes, everyone knows. Yeah, redness in lung area of the tongue could be. Also, lung yin deficiency, what else we will see in the tongue? I've shown you if it is chronic, because lung yin deficiency is not acute, right? It will not be starting. No, it's not night breathlessness, lung yin deficiency. Mm-mm. Cracked tongue where? Crack in the lung area, right? If it is really chronic, crack in the lung area, which you will see in the smokers, right? Okay, got it. So everybody, okay, let's go further. Incoherent speech, loud voice, incoherent speech. That indicate the heat is disturbing the shin, the spirit or mind, and usually it will be accompanied with impaired mental function. So impaired mental function, right? And the person will have like schizophrenia. If you have seen some people with a schizophrenia also, right? Sometimes they can be very loud and incoherent speech, you know. So that is showing the impaired mental function. The heat is disturbing the shin. Okay, so this is the cheat sheet for you. The people excessive talking has heat, sudden loss of voice is wind heat, and loud voice is excess pattern. Gradual loss of voice will be lung qi deficiency or lung yin deficiency. Not wanting to talk, that could be lung qi deficiency. Okay, loud voice is excess pattern. So you saw the heat and the cold pattern also. Okay, there you go. Coughing. Coughing is connected directly with the lung. We know lungs ability to disperse or properly dispose the extra phlegm, extra mucus, and all those things. So that usually the lung chi should be descending, going towards the spleen, and then when you are taking a deep breath, you know. So when you are taking a breathing, you are actually nourishing the lung, obviously the lung chi, and then when you are actually putting the diaphragm down, you know, when you're doing the abdominal breathing, you are actually descending the chi further to spleen, stomach, to middle GI. And when you take a deep breath, right, really deep breath, that means then you are actually pushing the diaphragm much down and supplying the chi to the lower GI, that means to kidney, right? Okay, the coughing is opposite to that. Coughing means the lungs want to clear or dispose or disperse the extra mucosa phlegm which is formed inside your lungs, you know, it has to dispose. So it is actually rebelling. So it's a rebelling chi or ascending the chi. It want to ascend the energy, you know, to come out. All the extra, which is it's not only the dispersing the what you say phlegm or mucus generally, but also the extra, anything extra which is in your windpipe, you know, which is in your air pipe or in your trachea, going down, even the food stuff, if it goes, you start coughing, so that's the same thing. It want to disperse something, so it could be phlegm, mucus, dampness, water, even water when you drink, and it goes to your windpipe, then you have to trachea, you get the coughing. So it's a rebellious chi. So lung chi is rebellious. That is a cough. Why in the listening diagnosis we are learning? Because different type of cough will give you a different diagnosis. So wheezing or rattling from the lung. So wheezing sound usually you will see in asthma or pneumonia, right? Wheezing sound. So wheezing or rattling from the lung is usually the mucus or phlegm in the lung. So you will get in pneumonia, you will get in asthma, you will get in COPDs, right? Emphysema and all. Okay, bronchiectasis. So you will get wheezing, rattling sound, like paper rattling also inside when you can also hear obviously with a stethoscope, but while coughing, because this Chinese medicine diagnosis we are talking about, when there was no stethoscope, right? They already are in the textbook written by Chinese people, or, almost 2000 years ago. So that time they could actually, with the wheezing, they can say, oh, there is a mucus of phlegm in the lung. So while the person is coughing, you have to diagnose already, and then you already know if there is a mucus of phlegm. What will be the best point if there is a phlegm? And what will be the best point if there is a mucus or dampness? Mucus is dampness. Phlegm, which is a sticky matter. So you understand the mucus is form of dampness, which is more watery, and the phlegm is more sticky, turbid, right? So that's a difference in phlegm and what you say. Lung 7, stomach 36, Ashwarya, nice try. You can give this point, but what is the main point I will give for the phlegm and what is the main point I'll give for dampness? Who will tell me what is the main point for phlegm? Kaushal, super. Stomach 40 is the main point for phlegm. Other than that, obviously, you can give CV 17 or range 17 to open the chest or open the lung capacity, improve the lung capacity. To try to learn the points also when you are learning the diagnosis, when you already know the diagnosis by just listening the sound of coughing, you already know which point I have to give. The bulb should light inside your brain, that I have to give stomach 40 because I can hear the flame wheezing, the flame you can hear, the wheezing sound you can hear. I can't cough like that. Okay. Obviously, okay, I just tried. But yeah, okay. So the wheezing, rattling sound, if you hear in the coughing, that means you have to give stomach 40. And for dampness, which one I will give? So sometime you will see the coughing, like the person is coughing, wheezing, but the water droplets are coming out also. That is means the extra dampness is there. Which will you will give? Spleen 9. Milan, brilliant. And Kaushal, you are also brilliant. Spleen 9, yes. Dampness, when you think about dampness, think about spleen 9, nothing else. If you have just one point to think of, dampness, spleen 9. I think November 23 certification batch, they're having the interview on 23rd of January. You must listen to me what I'm saying. And I hope you are all attending my class today, right? So yeah, and that's why I'm also telling you all these things. Yeah. So dampness, you have to think about spleen. First is spleen, think about spleen 9. You can give all other point of spleen also in the dampness. Yes. Okay. And then phlegm, obviously you will give lung 7 and all those things, even lung 6 and all. Yeah, but the main point will be the stomach 40, which is the low connecting point, and for phlegm, it works miraculously. Yeah. Okay. There you go. An explosive, very loud coughing that indicate access pattern. Very loud. I think I was, I tried to cough like that, explosive. Too much. That shows that indicates the access pattern. Too much heat, if there is too much lung heat also, too much access. So access pattern doesn't really mean The lung heat is only, yeah. Excess means also excess phlegm. Okay, too much, and then obviously the inflammation which is giving you the heat. So too much lung heat along with the phlegm and along with the mucus, so much, that can be explosive also. Okay, so too much phlegm also can give you explosive, and it will be acute. Okay, excess pattern are acute, superficial. Remember, yang pattern, right? It's excess. So that is lung heat and with excess phlegm and excess mucus. That will give you explosive or very loud coughing. The people, you may even see the droplets while they're coughing. There will be droplets if they are sitting in front of you before your table, before you. You will see when they cough, actually some droplets can come to till to you also, or you can see in the droplets on the table as well. I have experienced that kind of people also. So obviously you have to be careful. It can be, here you go. Cough. A weak cough indicates a deficiency pattern. Usually you will see in the old people, they are very weak. They're not, they can't really cough, very weak, like that. Something like that. I'm just trying to show you that thing. So weak cough. Usually you will see in the old people. Also, if they have tuberculosis for long, long, long time, not young people, usually old people again, you will see that also, weak cough. Or even the smokers and lung cancer and all those people, you will see the weak cough. And that indicates a deficiency pattern. And whenever it's a deficiency in the lung, you have to think about lung yin deficiency, not the lung yang deficiency. Okay, lung yin deficiency always. Lung heat, that is the excess pattern, and deficiency pattern is always or mostly lung yin deficiency. Okay. Cough, a dry hacking cough, usually that indicates the heat and dryness in the lungs. So dry hacking cough, it's like dry cough. You can hear the sound, it's hacking, like hammering, and dry like that, and because there's a dryness in the lungs. Okay, so dry cough, and the people will also say like nothing coming out, and they are like feeling sore to cough and all. So dry hacking cough usually indicate the heat and dryness in the lungs. Unproductive cough with small amounts of sticky sputum, that indicate the heat is scorching the fluid. Okay, so this was also similar. The heat was already making the fluid down and dryness. So that was dry hacking. And another thing, unproductive cough. Okay, the cough unproductive means not coming out, the mucus and all those things. Very small amount of sticky sputum coming out, So phlegm is coming out, but very small amount. And sticky, that means even phlegm is getting dried. That means heat is scorching the fluid, which is same like heat and dryness in the lungs, right? Similar. Breathing. So now you learned about the coughing already. Okay. Cough is a rebellious chi, right? Wheezing, rattling is because of the mucus phlegm. So we know explosive, very loud is indicating the excess pattern. Weak is a deficiency pattern. Dry hacking cough is heat and dryness. And unproductive cough with a small amount of sticky sputum, that means heat is scorching the fluid. Same thing, lung heat. Now let us see the breathing. So a person is not coughing, breathing. Now you have to just listen to the breathing. How does he breathe, right? If he's breathing loud and coarse breathing, that is excess pattern. Loud and coarse breathing, that is excess pattern. So in excess pattern, if there's too much heat, too much cold also, that will be usually too much heat. It will be, that will be loud and coarse breathing. Now, shortness of breath, weak and or difficulty breathing, that indicate the kidneys are too weak to grasp the chi. So kidneys are getting the chi from the lungs. But if the shortness of breath, obviously the chi is not reaching till kidney also, right? Okay. And that is the deficient type of asthma. So asthma has two types, excess type and deficient type. In deficient type, the people will have difficulty breathing and shortness of breath. Old people will be having, and again, their kidneys are usually weak anyway, right? And then kidneys not getting cheap because of shortness of breath, right? Okay. So you have to teach them this exercise, deep breathing exercise, like open your wings, breathe deeply, and you know, all the yogasana breathing, that bhujangasana breathing and all those things, and how we breathe. What do you say? When we breathe heavily, breathe in and breathe out like this. Like that, something like that. You have to teach them if they have this thing, because the kidney is not receiving the chi. So remember, in the cruise and even in your clinic, you are going to teach them some breathing exercise if they have breathing issues, right? So your whole idea, even with the pranayama, kapalbhati, bhastrika, whatever you're teaching, you are moving the lung chi till the kidney, because we all do the shallow breathing normally, and the modern world is all about the shallow breathing, because they are not working hard that they have to take a deep breath, sometime, so only you're gymming and all those things, or swimming, you are doing the deep breathing exercises that, otherwise, yeah, if you have a sedentary lifestyle, you are making yourself sick, because the kidney stores the essence, and kidney essence connected with the aging system. And if kidneys are not getting the chi, because you are not breathing deeply and supplying the chi till the lower jiao, that means you are dying faster. Everybody has to die, but you're dying faster. Okay. Everybody's dying because we are going towards the death. We all know, right? Okay. But yeah, you can have a better lifespan and healthy lifespan. What we talk about, the concept of longevity connected with the kidneys. Okay, so we all should have the healthy kidneys. So that's why pranayama makes has the anti-aging effect also. That's how the Ramdev Baba has all the black hair and all, not gray hair, because gray hair means kidneys are getting weaker, right? Okay, all right. So yeah, so black hair and all those things. We can talk a lot. Yeah. So breathing. Now, we saw the loud and coarse breathing was the excess pattern. Yeah. Okay. So the shortness of breath, a weak or difficulty breathing is indicating the deficient type of asthma, but loud and coarse breathing, if the person is having preference to exhale, when they have like a difficulty breathing, like a little bit, but they have exhaling, a lot of exhaling and loud and coarse breathing. So loud and coarse breathing and preference for exhaling, that means indicating the pathogens are retained in the lung, which include the excess type of asthma. Okay, so deficient type of asthma, people have difficulty breathing. Excess type of asthma, they have the loud and coarse breathing with preference for exhaling. Okay, all right. So I hope you understood that. Okay. So they're getting constriction. The asthma people are getting the tracheobronchial T constriction. So they have some difficulty. Yeah. Okay. But if they have difficulty and weak and deficient, that is deficient type of asthma. If they are doing more, like I think you would have seen people with asthma, they do that, loud and coarse breathing, and they exhale a lot, like the I've shown you the picture also to make you more understand. I think in practical, when you see these patients and you will observe these things, you will be able to make this better. So without practical, obviously, because all clinical, these are all clinical. So that's why, at least with the clip art, I try to make you more understanding. Okay. All right. So frequent sighing. If there's a frequent sighing, what is sighing? The people not having really difficulty breathing or loud, coarse breathing, but they take deep breath. Huh. When you're stressed, what do you do? If your boss says do something work and you get irritated, oh my God, whew, something like that. So that's sighing. You actually bring your shoulder up and release. Oh my God. So that is sighing, frequent sighing. If there's a frequent sighing, that is showing the liver chi stagnation. Now, who will tell me the inquiry method, liver chi stagnation? Liver chi stagnation inquiry method means what are the symptoms of liver chi stagnation? The first symptom I already told you, sign. Temporal headache. Yeah, could be there, temporal headache. That means liver yang rising. Menstrual issues, yes, could be there, PMS. Not all menstrual issues, just PMS. PMS and at the time of menstruation, the breast tenderness. That's, yeah, in the women's. That would be liver chi stagnation. What else other than that? Who will tell me other than that? Liver chi stagnation may not have fatigue, may not have anxiety, may not have depression. Rib pain. Who told me rib pain? Sagar, no numbness or nerve pain. No. That numbness and nerve pain, Sagar, that is in liver blood deficiency. Remember, liver blood deficiency will give you numbness and nerve pain. Yeah. But yeah, moving rib pain. Kaushal, you're right. And somebody told me earlier also the rib pain. Who told me? Govindrajan. And who told me the first? Obviously, Kaushal told me. I want to recognize who else told me. Padmanabha, no anxiety. Thanamudan, no convulsion, no depression. Rib pain also, Govindarajan told me, yeah, and Kaushal told me, moving rib pain. Moving rib pain. So they'll be having pain. Oh my God, I'm having pain today here, then here. And even on the right side, they will say, oh, I think I'm getting heart attack, something like that. I have angina also, such thing. So when you get really stressed and liver chi stagnation, the moving rib pain will be there. So it will be more muscular. It will not be what you say sharp and stabbing. The angina is sharp stabbing. The people won't be able to speak in angina. That moving rib pain is just like here. And if you ask them where it is, and they will say, oh, maybe here. And again, you ask them where it is, oh, it's here. So that is moving rib pain. So they will say here, they'll be having confusion where it is actually, because it's moving. Yeah. Okay. So that's moving rib pain. What else? Belching, Sriraj, really liver chi stagnation? Hmm? Nausea, belching. Priya Bhaskar, no. Nausea, belching is not. Excess of gas, nah. Craving, floaters. Who told me floaters? Kaushal, the best answer. Floaters. You will see having the floaters with liver chi stagnation. So liver chi stagnation, obviously, it can go to liver yang rising too, and then you can have floaters. Remember, floaters can be there with the liver chi stagnation. I hope everybody knows the floaters. Yeah, Govindarajan, they can be neck and shoulder tension, not pain, neck and shoulder tension, right? Neck and shoulder tension, Govindarajan, nice try. Padmanabha, they may not be epigastric pain. If it is epigastric pain, there is something else going on too, right? It's not because of the liver chi stagnation. Blood vision, no, not blood vision. Floaters could be there. Blood vision is already the liver blood deficiency that can give you the blood vision. Mood swing, not really mood swing. That is more with the kidney yin deficiency. Or it will not be mood swing. It will be more with the irritability or agitation. The person will be irritable. It's like if you did not sleep last night or you're doing some stressful job and somebody is asking you some help and you'll be irritable. No, something like that. So that's irritability or agitation will be there. Impatience will be there, impatient, irritable, and agitation. That could be with the liver chi stagnation. Sriraj, yes, breast distension could be there. I already told you the breast tenderness will be there at the time of menstruation with ladies, and that's a liver chi stagnation. And liver chi stagnation, what is the liver chi stagnation in our day-to-day life? What is that? Stress, yeah. Stress is liver chi stagnation because you cannot say Vikramacharya, no, not lethargy. Lethargy is spleen chi deficiency or chi deficiency, right? Usually, when we talk about spleen chi deficiency, we talk about lethargy and fatigue. Okay. So, because in clinical practice, you cannot say to person who is stressed, you cannot say, oh, you got liver chi stagnation. If they got temporarily, oh, you got liver chi stagnation, then they will think about, oh, my liver has got some issues. You cannot say that. You can say just one thing. I think you're getting more stressed, and stress is affecting your system. And that's why it's giving you headache as well. So you can explain them. uh, Obviously you have to explain them in their language. You cannot explain them in the what you say, TCM language. So you have to be suppressed anger. Tainamudan, no suppressed anger. You're going further. Suppressed anger. Okay. Suppressed anger is something very further. This is only stress, agitation, irritability, something like that. Hiccups. I think everybody would have got one or other time hiccups. You eat something or you eat something dry. I'll tell you one thing. If I eat dhokla, so Gujarati, if anybody is Gujarati, or you are having the dhokla, so if you're having dhokla, usually that dry. And if I don't have chutney, so sometimes, I don't eat very spicy food. And sometimes what happens with the dhokla, if I get, so dhokla is dry. If I get dry, I feel like, oh, I have to have chutney. And usually chutney in the market is having chili. So when I dip in the chili sauce or chili chutney and I try to eat dhokla, what happens? I start getting hiccups. I need to drink water. So what is that? That is stomach chi rebelling. So how you saw the coughing was, so this is hiccups, or you can say hiccups, hiccup. Because the cough is not coming from the lung, it's coming from here. Something is higher, actually lower, but it's actually rebelling higher. So it is hiccup. So hiccup is coming from the stomach because you eat something which is dry or chilly and your stomach doesn't like, so that's creating the hiccup. So rebellious chi, nausea, vomiting is also rebellious chi, so your stomach want to disperse something which it's not suitable and want to disperse, so it's creating the ascending chi. Again, stomach chi is always descending, same like lung chi is descending. The stomach chi is also descending, right? So whatever you eat the food, it always goes down, doesn't come out. Only come out when it's abnormal, like nausea, vomiting, then it comes out, right? So that is the rebellious stomach chi because it's rebelling. The stomach chi has to go down, descending down from stomach. The food, after getting processed in the stomach, after getting churned and partially digested, whatever, then it has to move further to small intestine. That means the first part of the small intestine, which is duodenum, right? So it has to move toward duodenum and obviously then jejunum and ileum. Yeah. So you must all know the parts also, already, right? So if the stomach food your body doesn't like my body doesn't like chili, and if it is too strong or if it is dry also, if I eat something dry, like if I just eat dokla also, I avoid chutney, then also I get hiccup. That is hiccup. So obviously you'll be jumping if you have a something. Yeah. I hope you like my clip arts. I got some time to choose them uh, from clip art gallery, and it's a little job, you know, to fix in the PowerPoint also. Okay, it takes some time. So that's why let me tell you, the people who are contacting me when I have to take a class, I'll actually request you don't contact me after 4 o'clock on that day. Okay, because usually I'm busy. Sometimes I'm busy preparing because even I'm running a small clinic and I have a few patients also in the morning time. So usually I keep them till 4 o'clock, and then so between patient also I can reply you, but when after 4 o'clock sometime, especially on the day when I am going to do seminar or presentation, usually I am busy in doing clip art and all. So I have a matter maybe ready, but then I'm doing all these preparation sometime, you know. So after 4 o'clock, maybe do not disturb me. DND, right? Only on the seminar days. Other days you can, yeah. Also, okay. So obviously, or you can leave the message that I don't mind, but don't expect me to reply you on that day immediately, right? You have to keep patience. Or if you're calling me, avoid calling me on the day of the seminar. Other days, I'm free, yeah, to give you answers, right? Okay, so hiccups and this one, Borborgmes, hard to pronounce. Borborgmes, right? Borborgme. Who will pronounce right to me? Anyone? You can unmute and pronounce for me. Bor Borborgmes. My tongue always slips. Borborgmes. It's same like your stomach, your abdomen is making some noises, gurgling noises. You know, you can hear something is there. Like when frog is sitting and making sound, you know, something like that. I can't make that one. You know, if the person is having usually diarrhea also, you know, when they are sick and having diarrhea, so they get that noise. Borborg means, you know. Also, sometimes your digestion is not good and you are eating and you have a bloating, you know, and then also Borborg means can be there. Flatulence, along with the flatulence, it comes. So gas also moves, you know, and that can also produce the sound. And that indicates, so if you hear the Borborg means like you have given the person acupuncture. I have done that, you know. So I'm just giving you practical example. So while inquiry, while consultation, you may not hear Borborg means when the person is relaxing. So I just heard this sound yesterday. I was treating somebody, you know, for the knee pain and back pain. So she was relaxing, and then I was just sitting beside, and then while she was relaxing, when I usually I leave them in the room like 20 minutes, 30 minutes, but in between I always check them. So when I was checking, I heard the stomach was making the noise. You know, something like that. So that is Borborygmi, and that is always when we have spleen Qi deficiency or spleen Yang deficiency. So there'll be bloating and loose stool can be also there. So usually spleen Yang deficiency will give you loose stool. Spleen Qi deficiency may not give you loose stool also, right? Remember, so bloating will be there. Okay, also it can be due to liver qi stagnation, which is invading the intestine. So that's like progression of liver qi stagnation means you're getting too much stress that's affecting your digestive process, and in intestine it's making more gases, right? Okay, so that is because of that too. So if there's no spleen chi deficiency, let's see, when you heard this Borborygmi, you have to check the tongue now. Yeah, check the tongue. If it is pale, teeth marks, spleen chi deficiency, pale, swollen, teeth marks, spleen yang deficiency, but normal tongue or side reds, red on the side of the tongue, that is liver chi stagnation. So see how you can differentiate, differential diagnosis, right? Okay.